commence their nationwide strike if their complaints will not be addressed. The health workers are complaining of lack of protective equipment during this COVID-19 period. So far, 16 health workers have died of COVID-19, while 850 others were infected with the virus. According to their union, that's listening, and let's get to hear what it is that they said in regards to the same.
Kenya Union of Clinical Officer, and of course, which amount or rather which the ministry has been referring like we are lamenting. It is on a Saturday that we want to say we want to stop lamenting and we want to act. In this manner, over 17 healthcare workers, cadres, have resolved unanimously to issue a strike notice in the context and the manner that I will be able to read. But before then, let me make a very important remark. They have 3 months down, they have not paid members. They're still intimidating healthcare workers. We are already stressed and we have enough to bear with. Not any intimidation. Vihiga is another case. We have Vihiga County, which have not paid over 787 healthcare workers for 9 months. This is the pain that we have. And we are experiencing the pain in a manner that our members are going several months without any pay. They are not able to meet, to eat, to buy food, to commute to work, and even to dress properly as professionals. We have to say that it has come to time that it must end. It is a time when we have a ministry that has received numerous contribution, donation, and even funding from the government. But nothing is reflecting on the ground. We do not appreciate as the practitioners. Nothing is happening. The announcement by Mr. Mutahi Kagwe, Honorable Mutahi Kagwe, who is the CS, does not actually bring the picture on what is happening on the ground. The healthcare workers are working under very dire situation. They said they were to test people for COVID-19. It has not happened. And even for those who are being tested, the procedure is actually flooded. I do not understand if at all this is what is happening for the healthcare workers who understand themselves and understand what is supposed to happen. What if it is the other Kenyans who do not know these procedures? You test someone for COVID-19 and only getting a result after 11 days. Even when some of us, and of course I can mention several facilities like here in Nairobi, starting from Local Health Center, Ngara Health Center, we have had healthcare workers testing positive. They are picked without even the knowledge of their colleagues whom you work with. You are not even informed that this tested positive. And this is to mean they are avoiding to do contact tracing. They do not want any other facility to be closed down because they have not been able to prepare to ensure that the facility are running without interference. So therefore, with this all painful moment that we are experiencing at healthcare workers, the Kenya Union of Clinical Officers, the Kenya National Union of Nurses, the Kenya Health Professional Society, the Kenya National Union of Medical Laboratory Officers, the Kenya National Union of Pharmaceutical Technologists, and the Kenya Union of Nutritionists and Dietitians wish to state as follows: that on 4th May 2020, the above-mentioned healthcare workers jointly issued a strike notice about the safety and welfare of the healthcare workers. And indeed, we were particulars in this manner. We demanded that the provision of the protective gear be provided to all healthcare workers.
Now,